Good day, this is Professor McClammy going over Introduction to Pharmacology. So it's very important to show up to class on time and to log on to your computer and make sure everything technical is working before taking your quizzes. Make sure you do your readings prior to class, ATI, and all of your assignments. So definition of a drug, any chemical that affects the physiologic process of a living organism. Pharmacology is important in nursing because we spend a large amount of time of our day actually giving medications. Anybody can open a pill packet, but actually giving the medication and knowing about it is very important. So this is an example of a medical diagnosis of asthma, and it shows the nursing process of all the different components that you need to know. So this is probably your first time, or maybe for many of you looking at the nursing process. So I'd read through this and just really notice what they have in each of these categories, because you guys will be doing many nursing diagnosis and processes in the program. So this is information about pharmacology you guys can read over. As far as medications, they have 3 different names. There's a chemical name, a generic name, and a trade name. So be familiar, especially with the generic and trade names. For many of these, chemical we're not too focused on in this course. Chemical name describes the drug's chemical composition and molecular structure. Generic name is non-proprietary. It's the name given by the U.S., and then the trade name is a registered trademark, more for the independent companies. These are the different ways to give medications. Parenteral means IV, intramuscular, subcutaneous, intradermal, intrathecal, intra-articular, and those are the different ways that you can administer it. Pharmacokinetics is the study of what happens to the drug as far as absorption. You guys can read through that slide. And then the first pass effect is something very important to know what that means. So it's the metabolism of the drug in its passage from the liver into the circulation. Many of the PO drugs are affected by this first pass effect. And this kind of shows the diagram of medication being swallowed and all the different processes that it needs to go through the body in order to be metabolized. Pharmacokinetics is the distribution of the drug, the transport of a drug by the blood to the site of action. And then this is a diagram of the drug transport in the body. Pharmacokinetics has to do with metabolism, alteration of a drug into the inactive metabolite in the body. This is pharmacokinetics talking more about metabolism and what it means, and pharmacokinetics as far as the excretion of the drug. So majority of them are excreted through the kidneys and liver. Half-life is the time it takes for 1/2 of the original amount of drug into the body to be removed. So if you have a 500 milligram dose, the half-life is 2 hours. So therefore, they would still have about 250 milligrams in the body at the half-life, because that is half of 500 milligrams. It's important to know about the onset, peak, and duration of medications, know about peaks and troughs and what that means, and which medications that is really important for, and then pharmacodynamics. This diagram shows about the different receptor sites and how the drugs enter the body, or the receptor sites. And for pharmacotherapeutics, there are different types of therapies. It can be acute, maintenance, supplemental, palliative, supportive, prophylactic, and empiric therapy. So make sure you know those definitions and what they mean. Let's see here. So monitoring of drug therapy, you want to know about the contraindications, unintended adverse effects, therapeutic index, and all that information. Pharmacology, know about drug interactions, side effects, synergistic effects, antagonist effects, and incompatibilities. So this breaks down what constitutes an adverse drug event, medication errors, and other drug-related effects. This has to do with how